Hi, I'm Dr. Gray, and today we're going to talk on an important topic that affects everyone that we know. In fact, I had a patient ask me to talk on this the other day, and that's called arthritis. Now, a lot of us don't realize that there's 7 types of arthritis, and one of those, even you may not realize, is gout. That's a type, but we're going to talk about the most prevalent one, which is osteoarthritis. In fact, arthritis is the #1 cause for disability. You're much more likely to have heart disease, diabetes, and a myriad of other diseases, including depression, if you have arthritis. And the good news is for the major arthritis that's out there, we know the cause of it, and that's joint misalignment. And so we're going to talk about how to solve that a little bit today. So as we talked about, there's 7 types. There's 100 categories. Major is osteoarthritis, and it's the #1 cause for disability. The #1 chronic opioid users are osteoarthritis patients. So that's another high risk that's out there. Can we do much to affect it? That's the question I always get. Well, all we got to do is look at the statistics in America. If you look at 2 different places in America and how they live their lives and what they do, #1 is Hawaii. They have about a 17% of the adult population have it. Where if we look at West Virginia, they have probably over 30%. So obviously there's things that we can do that address it. And the good news for everyone out there is the main thing that addresses it, which is chiropractic, is not even utilized. So there's 2 ways when we look at it here that you can treat a problem. I always tell this, if you have a bank account, you can either put more money into that account if you're trying to correct that, or you can take less out. So we do both here. We help put more in, and we allow it so that you don't have to take as much out when it comes to your joints and your body. Because when you're misaligned, what happens is it's like an engine that doesn't have its right alignment, or a tire that's going down the road and has a little wobble to it. The more you use it that way, the more it wears on all the parts that hold it together, and eventually they fail. In the body, what happens is as you have an area that's misaligned, and that creates more friction, and in response to that, your body develops spurs or little bony growths, just like you do when you get calluses on your hands. And the other thing it'll do is it'll break down the cushioning in between the joints as that wears it down. So what we offer is to make you more efficient and take away those wear spots. So in closing, 3 things you can do. 1, get a handle on your posture, because that's what when we talk about putting more in or taking less out, one thing that puts a lot of stress on your body is when your posture isn't where it's supposed to be. So #1 is posture and alignment. If something's not moving well or gets a little stuck, okay. #2 is diet. Obviously, what we put into our body can create inflammation. And most people are aware of this, simple sugars. And so we're going to say diet. And then the last part is when you look at a way of life, when you look at the difference between Hawaii and West Virginia, there's 1, they can be more active, but 2, besides having an environment that's more conducive to it, is lifestyle. So whether you choose to be active or sit, those things will affect you. It also affects your mental outlook as well, and that can affect your inflammation cycle, and that's a subject for another day. But those all have big effects. But for now, if you haven't had your posture checked, I highly encourage you to come in and get it checked. It doesn't take much, and it will give you a good feedback and a great feedback, and you can eliminate the #1 cause for disability that you're going to incur here in the United States. In other words, the #1 reason why you will quit moving and you'll be bedridden or lose your independence is osteoarthritis. This should be on the top of everyone's radar, and if you know someone, it might not be you, but you might know someone else that needs a little help this way. And help them out and give them this information. And if they're not in our area, we're happy to help you find someone that's in their area, because it's that important. Until next week, this is Dr. Gray signing off, and I hope you have a great Memorial Day weekend.